Thank you, Rob. Just wanted to do a sound check. No volume. Let's try that again. Can you hear me? Okay, good. Thank you. Sounds like you can hear me. I'm just going to wait to see if Kathy, are you there? Just going to take a couple of minutes here to see where my media support person is. Just bear with me. Hi, I'm just wondering, should I get started? Hello, it's Colin Lee here.
Colin, we finally get you.
Yeah, I didn't realize I had to phone in. I've never done this before. I thought I just had to log in and speak to the Facebook feed. So it's coming on live now. Okay. All right. I think I am on video as well now, if I'm not mistaken. So, okay. So I guess I didn't realize that I had to phone in on a phone line as well. So, Leslie, I'm going to leave it to you to start.
All right, well, I've already introduced you. Dr. Colin Lee's going to speak to us about with the variant updates for today. And I will turn it over to you, Dr. Lee, to get started.
Okay, great. Thank you very much. Thank you for joining us today. I'm Colin Lee, Associate Medical Officer of Health at the Simcoe Muskoka District Health Unit. I'm here to provide you with a UK variant update on the outbreak that's centered around, unfortunately, our area. At this time, we do have 10 confirmed UK variant cases or persons infected with the UK variant. We have a further 105 persons who have screened positive, knowing that there's still a second test that will confirm variants as well as potentially the UK strain. And then we have a further 110 persons infected with COVID, to which the lab we have sent to do the two-step variant testing, and that's at this time pending. Of note, related to the Bradford Valley outbreak, the Bradford Valley long-term care home outbreak, we were notified late yesterday that there are 5 residents who have now tested positive for the screen for the variant. We also looking at all the variant screen and confirmed tests. At this time, out of all of them, we only have 2 where we cannot account for a connection to the outbreak that is centered around the Verta Place long-term care home. So we've been working very hard in our case and contact management to get as quickly as possible to any case that would seem to be variant-related, contacts that are related to that, to ensure that they self-isolate and quarantine as quickly as possible to prevent spread. And like I said, we only have 2 that are unaccounted for where we don't know where they got it from. And that would represent where our concern is that there is transmission within the community that is stealth, that is unknown. And as we want to keep that number as low as possible, and certainly we're watching that. I think this really speaks to also that everyone needs to again stay at home, only go out when you need to for groceries or essential activities, and if you're feeling ill, to get tested. And we're looking forward to going out to our long-term care homes next week to give them their second dose of the vaccine to further protect them. So I'll stop there and I'll pass it back to Leslie to entertain any questions.
Okay, thank you, Dr. Lee. We have a number of reporters on the line. We'll start with Erica Engel from Collingwood and Barrie Today.
Yes, thank you, Dr. Lee. It seems to take a really long time to figure out if it is the variant of concern, and if so, if it's the UK variant. How important is it for you right now to find out quickly, or at least quicker than you are?
Yeah, so we want to know as soon as possible. We know the lab is being inundated because provincially this is a concern. When it gets to the lab, it takes at least 1 day to get the screen test done, and then the genome sequencing, the whole genome is at least a few days. We don't wait for those results to act. if we find a contact or someone who's ill, who has been in contact with someone who has tested, screened positive for variant, we act upon that. So we're certainly erring on the side of caution, but any results that come as quickly as possible would certainly help.
Follow-up, Erica?
Yeah, the two you said without a connection to Roberta Place, is that unchanged from the last update then?
That's right. It has been unchanged, and that's a good sign. It does mean that we do have a fighting chance to slow this down and, certainly believe in miracles, and maybe we might be able to contain it even further. We still believe that this outbreak is based on a source coming in rather than multiple sources of variant infection. So it's a good sign.
Okay. Matt Dingley from Global.
Hi there. I'm just wondering on the topic of contact tracing. If this does start spreading the way that many people are worried, or do you feel that you're adequately staffed with the correct number of contact tracers to stay on top of the variant?
I mean, to be honest, we can never have enough. And right now we're struggling to get to each person within 24 hours. I honestly believe that we are going to be continuing to be overwhelmed with more and more cases. Our partners at the provincial level, as well as our other health units in other areas in Ontario, have been very generous in providing us with that support, but we still need more people. So if it continues to, we're now in the second generation, third generation of cases. As it continues, those tentacles are just going to be probably too big if it continues on like this, and it will overwhelm us. That's what I see.
And just to follow up, how many contact tracers does Nova Scotia have, and how many would you ideally like to see to really stay ahead of that curve?
I don't have the exact numbers, but I know we have, I think, in-house at least 50. I think we've been provided with at least 30 or 40. We have had great help from outside. I honestly don't know what the numbers are. It really just depends on how many more contacts we get. As we get further and further out, it's really an exponential type spread, and that in terms of number of contacts. And at some point in time, if it does keep on going like that, we won't be able to keep up. And that's no different from how the pandemic has evolved. Our best chance is at the beginning, when the cases and contacts are small, relatively small. But as soon as we get to a certain level, which I hope we don't, but there is certainly the possibility of it, it will overwhelm our ability to do it in the kind of timely fashion that we want to.
Okay. Chris Herzog from TV24.
Hi, doctor. Excuse me. Can you speak about the two with no path of transmission? You had mentioned someone at a mental health care facility, Penetanguishene, or I think it might have been your colleague mentioned that. And then there was another person who was sort of the index case at at Bradford, who worked retail. Can you speak to those two with unknown transmission and exactly who they are, where they are, if one of them is the Penetanguishene person?
So, when we have small numbers like that, we certainly try to, our first and foremost goal is to protect the privacy of those persons. So I can't really speak much about who they are. All I can say is that those two persons, when we try to find out where they might have got that infection, it's not related to the first, second, third generation of infections from the Roberta Place cluster, and they're certainly not travel related as far as we can see. But in terms of trying to give you more information, I'm unable to do that, unfortunately.
Okay, can you speak to the exact exact size now of the Roberta Place cluster. A couple days ago, it was 257 people total, and also give us the fatality count.
Right. I'm just going to have to look it up. So at Roberta Place right now, we have, unfortunately, 128 resident cases. We only have one resident who hasn't been infected. We have 83 staff who've been infected. And that gives us an unfortunately high 56% attack rate for staff. We've also had staff come in from outside and helpers who have come in, and we have 10 of those persons infected. And in terms of total confirmed cases, it's at 227 total. And the tragic number is really that we have had 51 deaths in total related to this outbreak.
Okay, thank you.
Can we please make sure everyone has their phones on mute? We're getting a lot of background noise there. Thank you. We're going to go on to Kate Allen from the Toronto Star.
Hi, Dr. Lee, thanks for taking your questions. Can I just clarify something since the line wasn't super clear? Did you say 51 deaths or 61 deaths?
Sorry, that's 51 deaths.
Five.
That's right.
Okay. Okay, thank you. My question is, you mentioned 110 people whose samples have been sent for variant screening. Among those, are there any clusters that we haven't yet touched on other than the Bradford Valley, the Waypoint, and the Roberta Place clusters?
Yeah, so in terms of outbreaks, I think that's, we're looking at 3 different institutions that have had cases, and that's right. That's the Roberta Place, the Bradford Valley, and the a Waypoint. In terms of if there has been exposures elsewhere, there has, I think, been, sorry, let me have a look. Yeah, there's no other institutional exposures at this time.
Okay, so no other clusters being investigated for the potential presence of a variant?
Okay, so maybe I'll answer that question again. So in terms of when we have cases, we look at where possible exposures might have occurred, and at this time, those are the ones that we have confirmed exposures, and where there has been evidence of some transmission. We have investigated exposures in the communities, and at this time, I believe there is only one other setting where there has been transmission, but certainly not an outbreak.
Sorry, I'm not sure if my question is there though.
Right.
You mentioned that there were 110 samples that had been sent to, like, aside from the samples that had already screened positive or had whole genome sequencing.
Right.
There was 110 samples that had been sent to PHO for screening. I'm wondering if whether among those that you're screening for the variant or a variant of concern, are there any other clusters?
Oh.
Because I know super spreader events are one of the criteria.
Right. Yeah. So those samples have been sent because there has been likely a connection to the clusters that we know right now. We're also sending some of those samples also include current COVID outbreaks in our institutions. Just want to make sure that it hasn't penetrated, the variant hasn't penetrated other areas. But in terms of other clusters that have confirmed or screened variant positive, no.
Got it. Okay. And so also among those samples being sent for variant screening, that's where you don't have preliminary results back yet, are you doing more sort of surveillance type cases that don't have connections to, they either don't have connections to known clusters or, just don't have connections to any kind of outbreak, like just sort of random sampling of positive cases in the community?
So certainly within our area, best case scenarios, we send all of them for variant screening, but that's just not possible. So what we're doing is we're looking at outbreaks in institutions and sending some of those samples. And then other samples are also being sent where they are cases in other vulnerable areas such as in hospitals, because control measures might need to be heightened in those vulnerable populations. But that's what we're doing. We don't have the opportunity right now to send every single COVID positive patient's sample.
Okay, Mandy Webster from Rogers.
Hi there, sorry about that. I just have a question about the outbreaks at RVH. Are you concerned about those at all, Dr. Lee?
Now, any outbreak, any COVID outbreak is a concern to me. And with RVH, we have sent many of their staff as well as their patient samples to the lab to ensure that if there is a variant, that we know it as quickly as possible. We know they are caring for a number of Roberta Place residents, and of course, they are assumed to be to have the UK variant. But more importantly, we want to ensure that there isn't any transmission of variant within the hospital, as well as also as they admit patients from the Barrie area, as well as any other hospital, that it hasn't penetrated at a community level those patients. So we are trying to ensure within certainly RVH, because they are centered in Barrie, that none of their patients, other than the Roberta Place ones, are variant, as well as their staff who have tested positive for COVID.
And sorry, just confirming, you said that it's only the people from Roberta Place and their staff who've been confirmed to have the variant within the RVH outbreak.
Well, within the RVH outbreak, the Roberta Place patients, Roberta Place residents who have been admitted into RVH are not considered part of the outbreak because they had COVID before they came in. Within an outbreak, we're looking at COVID infections that are acquired within the hospital. We've certainly sent samples of those as well, and we have not received any positive screening from them as of yet.
Wonderful. Thank you for clarifying.
Okay, Brett Glover, Barrie 360.
Thank you, Leslie, and thank you, Dr. Lee, for taking our questions today. I'm curious, with so many staff falling in at Roberta Place, does the facility even have enough workers to meet the needs of the residents in the home?
I think it's fair to say at the beginning it was very, very difficult, and it has, been slowly improving. I think at this time, from what I understand, it is a lot better than at the beginning, and from what I understand, again, that the health and safety of the residents at this time is at a good level. We do need a lot of staff still because, unfortunately, many of these residents are still quite ill and require more care than usual. But we're getting a lot of help from various agencies like the Red Cross, as well as within the hospitals, Aurelia Hospital and RVH. But from what I understand, again, they seem to be coping at this time.
So we've heard from family members and residents of Roberta Place that they're not even able to speak to their loved ones over the phone. Could you point to reasons why that would be?
Yeah, it's understandable that when family call and they want to speak to either their loved ones or the staff, that not getting an answer is difficult. When when in an outbreak setting where the resident needs are high and are acute, unfortunately, sometimes I think the staff have to prioritize the care of the residents over answering the phone. That's what I've been made to understand, and I can see why that is. So I think that's certainly one factor, but I can certainly see how that might be. That's quite that's a concern from families trying to phone in and find out what's happening, what the status is of their loved ones.
Thank you for your time today.
Matthew Riedler from Moose FM.
Yes, hi. Thank you, Doctor, for taking your question. So far, the variant has only been confirmed in Barrie, but do you know if there's been any spread of it specifically into the Muskoka area?
So at this time, we don't. We also know that Muskoka, the pandemic up to now has had a lot lower number of cases, and we're hoping to keep it that way. I think everyone in Muskoka is being very vigilant, continue to be vigilant, and we hope to contain the spread as much as we can of the variant where it is right now, and hope to stamp it out if we have a little bit of luck and a lot of effort from our end.
And to follow that up, the messaging from Dr. Gardner on Tuesday was that people in Muskoka should act as though it is here and follow all of the proper protocols, the ones that they've already been following. Do you have anything to add to that?
Not really. It's, to fight against the variant, it's like really the exact same things we are doing, except that we do need to be more vigilant. If we combine everything from staying at home, physical distancing, wearing a mask, only going out when you need to get your groceries, it's never going to be 100%. And the problem is this very stealthy variant is 50% more contagious. It's able to find the little holes in our armor. So we just have to be just that much more vigilant with exactly the same thing we're doing.
Thank you, Doctor.
Now we'll go on to Siobhan from CTV Barrie.
Hi, Dr. Lee. I'm a little fuzzy on what you were saying about what's happening with the 5 residents with Blackwood Valley. Stand on that one?
Sure. So, as you know, we currently have an outbreak in Bradford Valley that has been ongoing since I think around the first week of January. By and large, it is under control, but there are still a few cases popping up in the last few days. So what we've done is we have sent the samples of these COVID positive patients, residents I should say, to the lab. And what has come back is it has shown that 5 of the residents have screened positive for a potential UK variant. So what that means is that certainly that outbreak, at least part of it, as far as we can see, has the variant going through the home. We still await the results of the other samples from other residents who have tested positive for COVID. I think the home, we have informed them, we've informed the families, and we're asking them to keep on their vigilance, to keep COVID, whether it's variant or not, at bay.
Follow up, Yvonne? Sorry.
Yeah, you talked about, I think they're included in that 110, that you're sending samples from other outbreaks. Can you give us some sort of sense of a cross-section of what kind of institutional outbreaks you are looking for variant in?
Yeah, so what we're doing is we're looking firstly at the geography, because given that it has hit Barrie the hardest, as well as to a lesser extent Bradford, centered around Bradford Valley home. So we're looking at that geography. Then we're looking at long-term care homes. We're looking at hospitals, and where there might be an outbreak in a rest and retirement home, we would certainly also be looking at that. And so those are the kind of vulnerable institutions that we're looking at. We're also testing people, obviously, who have been symptomatic or tested positive. Who have tested positive for COVID, who have a link, whether it's first, second, third generation to the original outbreak.
Okay, Dana Goldfinger, Global News.
Hi, Dr. Ray. Thanks so much for doing this press conference again with us today. I just want to go back to the Roberta Place cases just because it was a little bit muffled when you were speaking. So just confirming there's been 51 total deaths, 5-1.
That's right.
And is that just involving residents, or is that the one essential caregiver who was mentioned previously as well?
That's right. So it is 50 the resident deaths, unfortunately, and that one essential caregiver death that you mentioned.
Okay. Okay. And then 128 resident cases.
That's right.
And there's 129 residents, so it's just one person who hasn't tested positive. Is that correct?
That's correct. Yeah, one resident who's been uninfected at this time.
Okay. And then I have 83 staff cases.
That's right. Those are 83 who have the originally employed Roberta Place staff, because they've had other people come in to help. So we don't include that. It's just the 83 staff, which does unfortunately translate to about a 55% attack rate of the original staff.
Okay. So, sorry, the 83 staff are the people who had who've been employed there since the start of the outbreak.
That's right. Yeah.
Okay. So has anyone come in who's like a staff member at Roberta Place who's got infected since, or would it just be 83 total staff cases?
Yeah. So it's 83. Yeah. So it's 83 total staff who have been working at Roberta Place before the outbreak. And then we have 10 other persons who've come in either as redeployed staff or other persons who came in to help out, who've been infected as well.
Okay, is that what you refer to as external partners?
Yeah, so it's I guess we have separated it previously to 7 positive redeployed staff cases, and then 3 positive external partner cases. I've just sort of lumped them in because they're all helping.
Okay, so 83 total staff has been there since the beginning of the outbreak. 10 redeployed staff and 3 external partners.
Right. So it's actually 7 redeployed staff, and then 3.
Oh, okay.
Yeah, because I just added it up. To me, they're all extremely important people who've helped. I just added them together. Yeah.
So would it be accurate to include 90 staff who've been affected and 3 external partners, or are you guys not separating it like?
We've broken it down as such to recognize that there were original staff and staff that came in, but they're all staff to me, obviously, because they've been helping out. So
Okay.
certainly up to you how you want to enumerate them.
Yeah, I just wanted to make sure whatever was the most accurate way we were saying it. And then how many caregivers now?
We have 4 essential caregivers or visitors. 4 essential caregivers who've been infected.
And then that includes the ones who passed away.
That's
right. And how current are these numbers? Are they from today or are they from yesterday?
I believe they're from today, as of this afternoon. But as you know, these numbers unfortunately can change quite quickly.
Yeah, for sure. Okay, and then just one other question there. I know the health unit was investigating that travel link at Roberta Place. Was it confirmed whether or not that individual had violated any of the provincial guidelines or Quarantine Act rules, or is that still being looked into?
So we've looked into it very closely, and certainly from our investigation, we feel that individual, upon arrival back into Canada, went straight to his home, went straight to their home, and then that individual did their best to quarantine. And from what we can see, unfortunately, that individual failed in that attempt within the home and infected a household member. Certainly, there's no indication to us that that individual purposefully attempted, nor that individual left the home. But I think we all can appreciate that anyone trying to quarantine for 14 days at one's home after being away for a number of days or weeks, it's a very difficult task. And that, the best kind of quarantine is really when one stays in a separate location, such as a hotel upon coming back into Canada. And certainly a number of countries previously have taken that approach. Been very successful, for instance, in Australia. But in terms of this traveler, we've investigated it. That individual did their best to quarantine as far as we can see. Unfortunately, there was still contact and transmission that occurred.
Okay, thank you. And then,
Okay, we're going to move on to Chris Simon from the Very Advanced, please, just so we can get everybody in.
Thank you very much. Dr. Lee, just a point of clarity on the staff number. You said 83, but the health unit's website actually says 99. Can I get some clarity on why that's the case?
I honestly don't. I'm just trying to add it all up. It doesn't add up to 99. I'm looking at it at 83 positive staff, which are original staff, and 7 redeployed staff, and 3 external partners. So I can't see how it adds up to 99 here. The only thing I can think of is that the numbers have since changed, but I think we can certainly get someone to get back to you on that. I don't have the website up here, which states the 99.
For sure, I appreciate that. Dr. Gardner had mentioned on Tuesday that there was that he might be pushing a little bit for increased testing for the variant in this region, considering what's gone on with Roberta Place, and you seem to be a bit of ground zero for it. Has the health unit heard anything more about whether or not that capacity may become available at its disposal?
Yeah, so I did see a memo, I think it was today or yesterday, from the Ministry of Long-Term Care, which is implementing some rapid testing technology in long-term care homes, and that will certainly help. As unfortunately, it does take sometimes 1, 2, 3 days before we get the results. So if we have rapid testing done at in institutions where there are vulnerable populations, we can quickly get the results, the positive results, if they occur, when they occur, and start self-isolating them in order to prevent transmission. So I think certainly the Ministry of Long-Term Care has been working towards this, and it's a welcome that it will happen very soon in all long-term care homes.
Okay, and if you don't mind, we just had an email from a reader, and I tossed in this question. He's just curious what is being done to ensure that the people who are testing positive for the variant are staying in self-isolation.
Right. So yeah, when we contact a person who has tested positive for COVID, let alone the variant, we make sure that the where they're going to be self-isolating is adequate. And at this time, we are also offering, where needed or desired, and where possible, people who outside of their current. And we've been doing that throughout the pandemic, and certainly encouraging it a little bit more now, given that the variant is present.
Can I just ask what that might look like? Like that? Are we talking like hotel rooms?
Yeah, that's right. It's generally hotel rooms. Hotel rooms, a floor in a hotel where we would place persons who are in self-isolation. They get their food delivered. Obviously, they have the amenities in their room for the self-isolation period.
Thank you very much.
Okay, is there anybody on the line that I didn't get in the roll call?
It's Karen Howlett. I have some questions.
Yeah,
from the
can I just check? I haven't asked you yet, Karen. I apologize. Go ahead, please.
Okay, thank you. Dr. Lee, sorry, I'm a bit confused on the numbers too with Roberta Place. The 10 external staff. So would that include? Do those numbers include people like from the Red Cross, the hospitals, the hospice, like all those other community groups that are sending in staff to help?
That's right. I'm just looking at it, and yeah, so they've put in 7 positive redeployed staff cases, and those are the ones that are agency staff hired by the home, redeployed from other homes of that chain. And then there are 3 external partner cases, and I think that would be more in specific reference to other agencies, like you mentioned, like the Red Cross and hospice and hospital staff.
Okay, and the other day, Dr. Gardner said there were 90 what he described as household cases.
Right.
And it was a large group that included family members of people who live or work at Roberta Place, as well as some of these external workers. Can you just update that number or tell us where that stands?
I don't believe I actually have that number. So I don't know what that number is. I know he spoke to the media maybe 2 days ago. So I don't have that number at this time.
Okay, and just if I can ask a question about the Bradford home.
Right.
So in addition to the 5 residents who tested positive for the UK variant, that's in addition to 2 staff members, correct?
Right. So the 2 staff members have been confirmed to be the UK variant. The 5 resident cases have passed the first test, the screening test, and they will be moving on to the second test. And if positive, it would confirm that it be UK variant. I mean, there's always a possibility it's not the UK variant, but highly likely to be given the screening test and the fact that we have 2 staff who have been confirmed.
Okay, and if I can ask one more, has there been any kind of enforcement action or tickets or against anybody during these outbreaks, during all these cases? It doesn't sound like there's any possibility of any kind of enforcement action against the person who traveled outside the country. But are there any other potential enforcement cases?
Certainly at this time, we haven't charged anyone under any of our legislation. As we work with different individuals and different institutions, we've certainly, provided feedback on what needs to be done in the way that we normally do. But no, we have not pursued any charges either individually or institutionally that are related to this the UK variant outbreak.
Okay, thank you.
All right. Thank you very much, everyone. We're running out of time here. Thank you very much, Dr. Lee. I just want to remind everyone we will not be doing any reporting out to the media this weekend, and our next briefing will be on Tuesday, February the 2nd. So thank you all for joining us.
For Kathy? Kathy?
That was Leslie.
Oh, sorry, Leslie, can I ask one quick question? I was late coming in, so it was sort of an important question.
Sure, if you keep it brief, because we're running out of time here.
Yeah,
is that Mark?
Yeah, okay. So yesterday, the province said that the vaccinations were doubly reported. Did you address that earlier today? And are your figures accurate, the 16,000?
I believe they are accurate because every morning at 8 o'clock, I'm sitting at a table with a few people, and we do count it. And I do not believe our numbers are wrong. Obviously, with this report, we're going to go back and double check our numbers, but we believe our numbers are accurate.
Okay, thanks very much.
All right, and before I say goodbye, I'll just remind everyone that our variant numbers will now be on our website. So you can go onto our health stats webpage and see the two variant numbers, the ones that are screen positive and the ones that we're waiting on.